Well, today on the show, we're at the Singing River Health System's Regional Cancer Center talking to Stephen East, who is the Director of Operations.
Hey, Jim. How are you? I'm good.
Well, tell us a little bit of background, if you would, about the centers.
Well, we have two locations and also our extended medical staff. We like to think we have a collaborative treatment approach to cancer. It starts with our primary care through our specialists into our medical oncology and radiation oncology.
Now, you've got, of course, a lot of great people on the staff.
Oh, absolutely. We have 5 medical oncologists and we have 1 radiation oncologist. All of them have been very well trained. All are board eligible in their respective fields.
Now, tell us about care checks.
Oh, yeah, that's one of the things that we just found out about recently. We are #1 on the Mississippi Gulf Coast for providing cancer care and in patient safety in cancer care, and we're 10%, in the top 10% in the nation.
And you are a full-service cancer center as well.
Oh, absolutely. We had 2 locations.
Yeah.
This location is a clinic, and it's also a chemotherapy area. In our Pascagoula location, we have a clinic, chemotherapy, and a full service radiation oncology department.
All right, well, we're going to talk to some of the wonderful people behind the scenes here.
Oh, awesome, great.
Dr. John Bailey is one of the cancer surgeons at Singing River Health System. Dr. Bailey, good to see you again.
Yes, sir. Good to see you.
Tell us a little bit about your work here and your group.
So I'm in a group of 8 general surgeons, and I do the majority of our breast work here. I have done some special training in breast cancer care. So I'm certified in breast ultrasound procedures and breast stereotactic procedures. And we work with all of the physicians in the Singing River Health System, and in particular those in the Cancer Center, in our treatment of cancer patients. And so we depend on the primary care physicians and the obstetricians to screen patients, and radiology to find the abnormalities on ultrasound and mammography. And then I help with the biopsies and the surgical aspects of that. And our medical oncology associates at the Cancer Center do the chemotherapy, and our radiation oncologist does the radiation therapy for these patients. And so we have a tumor conference once a week where we meet and discuss these patients so that we have all of the aspects of medicine, including pathology, there together, so that we're able to generate what is the best plan for each individual patient.
Well, that's wonderful. Let's go talk to Dr. Gatewood now. Dr. Benjamin Gatewood, one of the oncologists here at Singing River Health Systems. Tell us a little bit about yourself.
Yes, sir. I am the medical director here, board certified in internal medicine and medical oncology. I trained in Jackson, did my internship, residency, and fellowship there, and have been down here since about 2011.
All right, give us a little bit of information, if you would, about the oncologist here.
So we have 5 medical oncologists and 1 radiation oncologist. Cumulatively, we span about 100 years of practice. The training we have from Cincinnati, Yale, several of us from UMC and Jackson.
Very respectable places.
Yes. Our radiation oncologist worked at Baylor and did rotations through MD Anderson.
What type of cancers do you treat here?
So we treat adult cancers, and we treat almost all of them so that the patients can get treatment closer to home. We treat the more common breast, colon, prostate. But we also treat more rare tumors like sarcomas and glioblastomas. We also do malignant hematology with lymphomas, leukemias, and benign hematology with things like anemias.
Yeah. Give us a little bit about the research and the clinical trials you do here.
So we have a very active research center. We have a dedicated staff that reviews every new medical oncology case to see if they might be applicable to one of the open studies.
Yeah. Well, we're going to talk to one of there's so many people that are involved in this, so let's talk to one of the physician's assistants now. Now, Brenda Bernstead is a physician's assistant here. How you doing, Brenda?
I'm good. How are you?
Nice to meet you. If you would, Brenda, tell us what you do here at the Cancer Center.
So I'm a physician assistant, which is a physician extender to the providers that we have here. So I'm able to see patients for appointments, order imaging studies, interpret lab results, dose their medicines, write prescriptions, and evaluate the patient. And I've also started doing a lot of our bone marrow biopsies here as well.
What sets the Regional Cancer Center apart from any other centers in the area?
I think the Regional Cancer Center has done a really good job at adding services for our patients to help kind of get the whole approach to their medical care. So we've added the physician assistant here. I started about 1.5 years ago, and in the meantime, we've also added Denise Taylor, who is our nurse navigator. So she helps kind of guide patients from their referral process through to the end of whenever they finish their treatment.
Tell us a little bit about patient education when it comes to dealing with chemo.
We help the patients deal with side effects that they may have, help with foods that they may need to eat, and
it's a big change in their life.
Yes. So any of the problems that they may encounter, Denise comes in with that a lot too as well. If she needs to help patients with their feeding tubes or breast prosthesis or anything like that.
All right. Well, speaking of chemo, let's go to the chemo center now. Well, now we're in the chemotherapy area of the Regional Cancer Center. Lynn Denmark is one of the chemo nurses. How are you?
I'm good. How are you?
Tell us a little bit about what you do.
We give our patients chemotherapy here. They usually go through a chemo education class prior to coming to us. When they come in our clinic, we're fortunate enough here to have our own lab here and pharmacy that mixes our chemo. So in this area here is where we give our chemotherapy. We also give supportive care for our patients that may have difficulty following their treatments with nausea, vomiting. We
Right.
bring them in for extra hydration and nausea medications.
What other services are available to the cancer patients?
We have our social services here. We have supportive care afterwards, after they've received their chemo. We have classes that they can go to see what they need to do after they complete their therapy to help them live a healthier life.
That's wonderful. You mentioned the services center, so social services center. So that's where we're going next. We're here in the wig room with Donna Burke, who is the social services director for the Regional Cancer Center. How are you?
Good. How are you?
I'm wonderful. Tell us about as far as what you do in the support groups and the wigs and everything.
Yes. Well, we realize here at the Cancer Center that it's important not only to take care of their health here while they're going treatment, but also for the emotional aspects and to help them in anything that they may need while they're here. So we offer support groups. We have individual counseling if that is also needed. We do have several other programs. We have a program called Look Good, Feel Better, where they can come in and have makeovers to help them feel better.
Oh, wonderful.
And we have a mentor program, which helps them also be linked with other patients that are going through something similar.
And see the great selection of wigs behind you there and
Yes,
have to choose from.
we're very lucky to have this room that we can bring the patients in. It's a private room where we can have them try on wigs, and we have hats and scarves and things for them, for the patients that are going through treatment that are experiencing hair loss.
Drug assistance?
Yes, we have a program where if they are getting some type of chemotherapy and maybe the copay is high, we offer support in helping them fill out paperwork and getting all the necessary information that they need to get assistance for drugs.
All right, speaking of financial assistance, let's talk to Michelle Hagerton now about that. We're in the financial services office now talking to Michelle Hagerton. How are you?
Good, how are you?
I'm wonderful. Tell us how the Regional Cancer Center can assist with a patient's medical bills.
We work very closely with our medical team and our patients. They have all different situations, and we have financial assistance for our Jackson County residents for those that may be underinsured. We have copay assistance programs. Some of our self-pay patients, we're able to get, depending on their circumstance, insurances that cover their treatments. So there's lots of different options that we work with to get them taken care of.
Wonderful. You know, we've had a great visit today, part of the Regional Cancer Center, and next month we're going to visit the Radiation Oncology Center, all part of the Singing River Health System.